Okay, so right now we're going to do a couple different demonstrations of how to accomplish a head-to-toe assessment. So when you first are coming into your patient's room, you want to make sure that you know the patient's name and date of birth because you're going to verify that right off the bat. So I'm going to knock on the door, wait for them to respond, and I'm going to enter the room. I'm going to introduce myself. Hi, my name's Misty, and I'm going to be your nurse today. How are you feeling?
Bad.
Oh, no. Why are you feeling so bad? What's going on?
Sick.
Oh, man. Well... Did he just laugh?
Yeah.
Sorry, the 5-year-old's a distractor. Okay, so this is my husband, and he doesn't know that he's not supposed to be role playing to that degree, but that's okay. What we're going to start off with is asking a bunch of questions just to kind of get a good picture of how you're doing beyond feeling sick. So, can you start off by telling me your name and date of birth?
Derek Weston, 12/22/91.
Perfect. And that is correct because, again, before I entered the room, I verified that I knew his date of birth and his birthday. Can you tell me, do you have any allergies to anything?
No.
Perfect. Do you know what month it is? What month is it?
May.
Perfect. And what year is it?
26.
And who is the president?
Trump.
And do you know where you are right now?
Home.
Beautiful. So the point there is that when I enter the room, I want to make sure that my patient is alert and they're responding, and if they're responding appropriately. If he would have had any confusion, it would have been present in the answers that he'd given. I never specifically ask the date itself because oftentimes I have to look to see what the actual date is on my own. So I can't expect a patient that's potentially confused to remember something that I struggle to remember. So I always just focus on the month and the year. So from there, I now know that he is alert and oriented ×4. That all seems appropriate. So then what I'm going to do is I'm going to focus in, starting again from the head, working my way down. So when I'm looking at his head, I'm looking to see if there's any injuries, if there's any swollen sides, any asymmetrical issues. I'm also looking to see if he has any lesions, bruises, or any abnormalities. If I had a pen light, I would be using it now to be able to take a look at the external ear to look for any drainage, swelling, or any issues from the outside. I would look on each ear. I'm also going to take my pen light and shine my light into his nose. I'm looking to see that the skin is intact, no drainage, no sores, or any injuries or issues there. I'm also going to look in his eyes. Now, when I look at his eyes, I'm looking for pupils' reaction to light. So I'm going to use my pen light. Again, I apologize, I don't have one for demonstrations purposes, but what I do is I need to have the light dimmed, and I'm going to come from the far side, and I'm going to bring my light in to be able to see the reaction of his pupils. What I'm looking for is to see that those pupils are going to dilate as the light is further away, and they're going to constrict as the light comes closer. And each eye should do that symmetrically. So I'm looking to see that the pupils are equal, round, and that they are reactive to both light and accommodation. So I do that for each side, making sure that that is appropriate. From there, I'm going to have him keep his head still, and he's going to follow just my finger with his eyes. We're going to do the 6 cardinal gazes. So we do a diagonal going the other way, and then we do side to side. Here I'm looking to see if his eyes have any issues with following, if he has what's called nystagmus, where the eyes will shake, or if there's any other abnormalities that could indicate if there was any cranial nerve issues. From there, I'm going to actually look inside his mouth. When I look inside his mouth, I'm looking to see, does he have any lesions, any white patches, indicating like thrush might be present. I'm also looking to see if he has redness in the back of his throat. And overall, I'm looking to see, is his mucous membrane, the mouth, is it moist? If his mouth was super dry, it could be that he just woke up and he just needs a drink. Or if his mouth is dry, it could be an indicator that he is dehydrated, because we're looking again at those mucous membranes for signs of dehydration. So from here, everything looks good. I've looked at his eyes. I also, when I was observing his eyes, I'm looking for any kind of crusty, redness, any irritation or anything there. Everything looks pretty good. So now I'm going to have him lift his head up and down. I'm going to have him turn his head side to side. I'm just looking there to see if he has any appropriate range of motion. Any pain or discomfort when you do that?
Nope.
Perfect. Now I'm going to test his shoulders. I'm going to have you shrug against my hands here. Shrug. Perfect. There I'm looking to see. You can go ahead and relax. I'm looking to see if he's having, if both shoulders are equal in height and if there's any pain or discomfort. And then I'm going to have him do, if he can, his own active range of motion, where he's going to bring his arms out, up, and down. That's me passively holding on to it just because I don't want him to hit my daughter that's holding the camera. But you want to get a good range of motion in place to see if he has any issues going on with the joints. You would do that at the shoulders, the elbows, and the wrists. From there, the whole time I'm assessing him and placing my hands on him, I'm feeling his skin. I'm feeling the warmth. I'm also feeling if he's sweaty, if he's cold and clammy, if there's any abnormalities. And I'm also doing a continuous inspection of his skin, looking again for lesions, bruises, or anything else that could be of concern. Now, if he were an older patient, that had very paper thin skin, I would be checking his skin turgor not at his hand but at his chest. I would pinch the chest and look to see if that skin tense and stays in place. That again is an indicator of dehydration. Because he's young, I don't need to use his chest. I can go to the back of his hand, pinch there, and release. And as soon as that elastic shows that it goes right back, that goes to show that he's very well hydrated and there's no concerns there. Here, when I'm at his hands, I'm also looking, again, for any sores or injuries, but I'm going to check his capillary refill. So I'm going to take the nail bed, I'm going to squeeze, see how the finger turns red. When I release, it should be less than 3 seconds that it takes for his skin, for the capillaries to refill back into place. If it took longer than 3 seconds, that would be an indicator of some altered blood flow, right? So that would be an issue that there could be something going on with his circulation. Luckily for him, his cap refill on both hands is totally appropriate in less than 3 seconds. Now, we've done the range of motion, we've done his skin assessment. Here, I'm also going to check his radial pulses. Here, I'm checking to see that both sides at the same time, that I can find them and that they're equal. And if they're normal, if they're weak, or anything else that might be abnormal. And then I'm going to have him test his strength. So I'm going to have you squeeze my finger as hard as you can. Perfect. Good. Equal strengths. Now I want you to pull me towards you. Okay. Good. Now I'm going to push you. Don't let me push you. Beautiful. You do the strength test at the same time so you can compare one side to the other. If one side were weaker, that could be an indicator of some sort of injury or potential stroke or anything else. All right. So we're going to pause there.